Hey, my name is Dr. Seuss. I'm a dentist at Clackamas Smiles. We get some questions about full mouth rehabilitation and really rebuilding your bite or your smile. I can talk a little bit about that today, answer any questions you might have. Full mouth reconstruction is the process for repairing the teeth. Now, whether it's one or two or three or four or the majority of teeth that are damaged, your dental work needs to solve the issues that you have, repair anything that's structurally broken or compromised, and give you back your ability to smile and chew and speak and be social. If you just have one or two teeth broken, chipped, or cracked, we can always just fix those. However, when more and more teeth become involved and the problems become bigger and bigger, what we're going to do is address the bite altogether. And sometimes that involves adjusting, fixing, or repairing or replacing the majority or sometimes even all of the teeth. That is a full mouth reconstruction. Candidates for full mouth reconstruction vary all across the board. We've seen young and up to the very old and men and women and just anyone can be a candidate for it. But I think the better question is, when might you need a full mouth reconstruction? And we meet patients every day that are like, well, I see this breaking down, or I see that my teeth are getting yellower. Do I need veneers? Do I need my teeth redone? Do I need them all replaced? And the majority of times, we don't need to replace all of the teeth. We don't need to replace all of the restorations. We don't even need to fix the majority of the teeth. So most of the time, the answer is no, you don't need that. But there are cases when all of the teeth are worn and the bite isn't functioning anymore. The top and the bottom don't match up and you just have lost all the function that you used to have. Those are the cases where you should start asking, hey, do I need to do something to fix my bite, fix all of my teeth, and really put me back into that position where I can function, where I can smile, where I can chew, when I can speak? How do I get that back? That's the question. We see lots of reasons that people might need a full mouth reconstruction, but to understand that, we got to back up and find out what are the reasons that people either break down most of their teeth, that have a non-functional bite. What are the reasons that people experience that kind of damage? One of the big ones that we see is a prior experience with eating disorders. Eating disorders can wreak absolute havoc on the teeth. The exposure to acids, the detriment to the diet, the malnutrition, all of those play in terms of damaging the teeth. Another situation that we see really damage teeth over a course of just as few as a short years can be acid reflux. Acid reflux is one of those silent killers of teeth where you don't even necessarily need to be aware of it or feel it. At nighttime, you could be having enough reflux that it's damaging all of the outer surface, all of the enamel. And once that protection's gone, it's gone. Our body has no way to rebuild that. So eating disorders, acid reflux. One of the third ones is a true dysfunction in the bite itself. So if you are a clencher or if you are a grinder, there are people that clench and grind so hard that they actually fracture and destroy their own teeth. So those are the three big categories that we see of people who might need a full mouth reconstruction. When people start asking, hey, how do I repair my chipped or cracked or worn teeth? When they start asking, how do I get my bite back? When they ask, how do I get my smile back? The answer has a huge variety, and it really depends on the type of breakdown there is. It depends on the kind of outcome you'd like to see. And one of the third things is it depends on how much structure you have left. So one of the most conservative ways that we can repair something like this is to just build up tooth by tooth. We can use composites or we can use crowns and we can take each tooth and make it proper and make it restored and fix it. And once we've done that to all of the teeth, or at least all of the teeth in an arch, you can get your bite back. You can get your smile back. You can be social. You can chew. All of those things can be restored. On the other hand, if you're missing so much of the foundation of your teeth, there's cases where that wouldn't be successful. Or if we were successful, it wouldn't last very long. And those are cases where we need to discuss, what are we going to build for the foundation? And if those teeth need to last a long time, if they need to look good, and there's not enough foundation left, then we need to talk about alternatives. And that can be as aggressive as dental implants, restoring those teeth or replacing them with something artificial like implants. So it can be one or the other depending on your foundation, but also your treatment goals, how long you'd like that to last. When it comes to full mouth reconstruction, there's a number of avenues that you could go. If you're going to replace all of those teeth and the teeth are going to sit on implants, then a lot of times your dentist will use the services of a surgeon, bring in someone to help place implants, or could possibly do those implants themselves. On the other hand, if your teeth are salvageable, if they're rebuildable, but they just need repair, maybe each tooth needs a repair, a general dentist is well versed to do that repair. Now, that's not the kind of training that each dentist gets in dental school. In fact, we were trained to do one or two or probably three teeth at a time. That's not something that you want your average brand new dentist doing. But as time goes by, as dentists get continuing education, as we study these kind of rehabs specifically, you'll talk to your dentist and you'll find out they're probably flying across the nation, learning these techniques and paying dearly for those courses just to get that knowledge of how to help their patients. Once you have that conversation, you'll get that satisfaction. You'll also get that trust that your dentist is doing exactly what they need to do to rebuild your smile. So the answer to that question is you need to have a discussion and find out if they're the right person for you and ask them how many times they've done it before. A full mouth reconstruction is wonderful, right? Because you just take your magic wand and we go poof, and then the teeth are perfect again. No, of course, that's not how it works. It's a process. If you have teeth that are damaged, they didn't get damaged overnight. And if they're broken, they didn't get broken overnight. And the same way, it's not really fair to expect us to be able to fix it overnight, although we'd love to. The process is much more straightforward. If there's something broken and we can fix it, we'll sit down and fix it. Now, that has to happen for each tooth. And admittedly, that's not a fun process, but it's something that we can do and the outcome's absolutely worth it. So if you're thinking, gosh, is this something I want to do? It sounds so daunting to repair all of my teeth. It sounds so scary to have this done. What you need to know is you're not the first one. There's people that have gone before you. And these are rebuilds that we love doing, because taking someone from a non-functional, a non-aesthetic, just a non-working bite where they can't be social and they can't live their lives, and fixing that so that changes and we can see their smile afterwards and we can see their loved ones. That's when we get the reward of saying, hey, this is something I was able to directly fix with my own hands. And that's when we get the most satisfaction too. Most full mouth reconstructions don't happen in one time. A lot of times there's some precursor buildup steps, there's some tooth repair steps, and then there's a long process where we trial the new bite, where we preview the new teeth, where you can just get used to the bite, the smile, the speech, the aesthetics, and make sure that that's a right fit for you. So anesthesia options, anytime we're doing a procedure, patient comfort is our first focus. Of course, the work needs to be impeccable, but the patient needs to be comfortable. The appointment times need to be reasonable, and you need to have time for breaks, stretch your legs, get some drinks, and get some nutrition in you. So anesthesia absolutely comes part with full mouth rehab, but it's not something that is dramatically different than you've seen before at other dental appointments. The process of healing from a full mouth reconstruction can be as quick as just a couple days to as long as a couple weeks. And the answer lies in how quickly do you get comfort with your new bite. Now, we take a new position of the jaw and make sure that that's comfortable, not just for the teeth, but also for the jaw joint itself. And once you arrive at that new position, you get a good sense of security and a good sense of trust in that new bite. Now, the faster that happens, the faster you'll consider yourself recovered from that one. During the temporary phase, you have the mock-up or the pretend version of what those teeth will look like. And that is your chance to look at them. It's your chance to test drive them. That's not necessarily part of the recovery, but it's part of the process of you deciding, hey, is this the right look for me? Are these the right teeth for me? Is my bite in a good, comfortable position? Once we've confirmed that, and only after we've confirmed that, do we have the real teeth inserted. Now, once those are inserted, they're yours. Eat, drink, laugh, brush, chew them, floss them. They're your teeth. And so realistically, there's not much of a recovery process after that. So it's the manufacturing process that takes a long time, but I wouldn't say that there's a significant recovery time with it. It's going through the actual manufacturing to make sure you get exactly what you want. After a full mouth reconstruction, we tell people, don't use your teeth as tools. If we catch you biting fishing line, if we catch you biting sewing threads, we're going to come right through the phone and we're going to attack you. If you're biting the top off of beer bottles, I mean, none of that is allowed, but you shouldn't be doing that with your real teeth either. So my strong belief is that any replacement tooth should act as good or better than the natural tooth, as long as you're following those rules. So chew the foods that you like, brush your teeth how you like. Make sure you clean in between them. I'd love it if you flossed. Please do all of those things, but treat your teeth like teeth. We're not going to put you in limp mode. Your teeth, they're not disabled. Your teeth work perfectly fine. They will work fine after a full mouth rehab, but you just got to follow those reasonable rules. So no, there's no restrictions. Use your teeth like teeth. One of the most common questions we get is, no matter what procedure we're doing, it's how long is this going to last? And the answer is, we don't know. It sounds like a joke. It's not a joke. How long do your brakes last? How long does an average car last? How long does, your latest iPhone last? All of those things have set lifespans to them. And the same thing is true with dental work. Let's look at it this way. We chew around 1,000 meals a year. So if a crown lasts 10 years, That's a nice long duty cycle. What we find is that the average lifespan of crowns is getting longer and longer. And whereas we used to quote 8 to 12 years, we're more comfortable saying your crowns should last somewhere between 15 and 20 years at this point. So that's the average lifespan of a new crown. When patients ask us about dental benefits and dental rehabs and maybe even a full mouth rehab, they want to understand, will my benefits help me? Is this something that's covered? With most dental plans and most dental benefits clocking in at somewhere around $1,500 to $2,000 a year, it would be very difficult to find a plan or a program that would pay for the costs that you would need to replace 10 teeth or 12 teeth or 24 teeth if you're going to do a complete rehab. So our patients have difficulty relying on insurance or dental benefits to repair significant problems like that. Insurance is meant to replace and help us defray the costs of sort of onesies and twosies, small things like that. Dental benefits are not designed at all to help with the cost of something like a full mouth rehab. So then if dental benefits aren't going to be helpful, you might ask the question, how might someone pay for something like a full mouth rehab? And the answer is, there's not a lot of people who just show up and write a check for it. Most people say, hey, I need to find some way to budget this into my life. I need to find some way to make this cost something approachable. And in the same way that people can finance cars or finance any other vacation or big purchase, they find basically the same kind of financing options for dental work. If that dental work is big or significant or even a full mouth rehab, there's lots and lots of avenues available. And we have at least 3 wonderful choices, even here in-house, to help with something just like that. If you think that you might need a full mouth rehab, if you know someone who, just by looking at their history and seeing how their teeth are breaking down or wearing, and you know that they might need a full mouth rehab, one of the best things that you can do is get your questions answered. It's a terrible feeling to guess. It's a terrible feeling to worry. It's a terrible feeling to not know. Why not take that first step and find out what's going on? How are my teeth breaking down? Most importantly, how can I stop it or mitigate it before you need a full mouth rehab? But if you want to have those questions answered, if you want to take a deep dive and find out what's going on with your own teeth or a loved one's teeth, the answer is as simple as picking up the phone and giving us a call. I hope that you've got some value from this explainer of full mouth rehabs and basically teeth breakdown and dental breakdown. If you have additional questions, if you know someone who might need this, if you yourself might need this, or if you're worried that I see things breaking down and I don't want to need this in the future, one of the best things that you can do is get seen early and get seen regularly, find out exactly what's going on. There's a way to keep that from breaking down. Take that action. If it's already broken down and you need to know how best to repair it so that you can have your smile, you can have your function, you can chew the foods that you want, and you can feel confident in your smile, give us a call. Our office number is 503-786-3000.